Good afternoon, everyone, and welcome to Getting Personal with Parkinson's. I'm Whitney Chapman, Programming and Production Manager for the Marlene Meyerson JCC Manhattan's Edmond J. Safra Parkinson's Wellness Program, supported by New York's largest healthcare provider, Northwell Health. For almost 15 years now, the JCC has been hosting programs for individuals living with Parkinson's. And you can find out about these programs on our website by visiting www.mmjccm.org/Parkinson's. You can see the link below in the comments section. I'm so glad you're here today. For those of you joining us for the first time, this program is for anyone whose life has been impacted by Parkinson's, those who are diagnosed, as well as family and friends. And our desire with this program is to put a face to Parkinson's and to introduce you to people living with PD and thriving with PD. We'll speak with experts, people living with PD, and those who care for them, as well as others in the field. I'm grateful that you're joining me this afternoon, and I want to ask you a favor. If you enjoy what you see today, I hope you will hit the share button at the bottom of your screen to share this with others who might be interested and benefit from the conversation. We'd really appreciate this support. And we'd also like your input. If you want to be a guest, or if you know of someone who we should feature, or if there's a specific topic of interest that you would like us to cover, please let me know. All inquiries can be directed to me, Whitney Chapman, at wchapman@mmjccm.org, and I'll put my email address below in the comments section for you. So, today's episode, I'm going to introduce you to speech pathologist Orit Greenberg. Orit and I actually met several years ago while in a yoga class, and I recently learned that she was a speech pathologist who specializes in techniques specifically intended for people living with Parkinson's. Orit and I had a chat that we pre-recorded, and I'm about to share with you now, and I'll be on hand afterwards to answer any questions you may have. As you listen to the conversation, please put any questions or comments you have in the chat, and I'll do my best to answer them. So, take it away, Orit. Orit Greenberg is a speech pathologist, and I'm just going to ask you, what is a speech pathologist? I've heard the phrase, but I don't know that I really know what it is you do.
So a speech language pathologist prevents, diagnoses, and assesses speech language, social communication, cognitive communication, and my specialty, voice, swallowing, and upper airway disorders.
How did you fall into this profession?
Very circuitously. I started my working life as a classically trained dancer. And then I went to college and studied psychology. I went back to the performing and creative arts world, this time behind the scenes, and I worked for Philip Glass and Laurie Anderson's live producer and in film and television. And I've always been interested in how people communicate, how people use their voice, and the connection to the brain. Obviously, dancing is nonverbal communication, but I've always been interested in how, like I said, people use their voice and how the brain, the relay between the brain and the voice in order to communicate.
So, wow, how fascinating. So, talk to me about speech pathology as it relates to someone living with Parkinson's. Why would someone, what can you do? What about Parkinson's would require or suggest that someone might need to visit a speech pathologist?
So there might be many reasons. Some clients who come to me, they are frustrated or have difficulty being heard or being understood. So they're frustrated sometimes that they have to repeat themselves. I might target a person's vocal quality, but because of the exercises we're doing, that fixed facial expression becomes more animated. Maybe they're having more facial gestures, or that slurred or mumbled speech that they might not been aware of. We call it dysarthria, the hypokinetic dysarthria. Their speech intelligibility can be improved. Or sometimes people with Parkinson's have a monotone speech pattern, and all of a sudden they have more inflection or intonation. And sometimes people have those short rushes of speech, that festination. Sometimes it sounds like stuttering, almost like that shuffling gait, but it's with their voice. And that can also be addressed along with the person's swallowing concern. So if you just want to try real quickly, just put your hand on your neck and just do an upward pitch glide. Go, ee. And what do you, beautiful, gorgeous voice. What do you feel your Adam's apple did when you made that sound?
I had to do it again. It went up.
Exactly, it goes up. If you have enough saliva, just put your hand there and swallow. What did your Adam's apple do?
It kind of went up and forward a bit, I think.
Exactly. So when we swallow, it goes up and a little bit forward, like you just said. And when we go up in pitch, our larynx also elevates. So just by working on some voice exercises that will help make your voice stronger, it also works on the same muscles that help your swallow improve. My grandfather had Parkinson's, and just witnessing the progression of the disease was very difficult for the family. It's really important for the family and the caregivers and loved ones to be a good listening partner. I know it seems simple, but position yourself face to face. Encourage conversation, right? As I spoke before, there's a tendency for people with Parkinson's maybe to disengage because it's frustrating when you're not heard or understood. So really engaging the person with Parkinson's. Also, when communicating with your loved one, short and concise phrases. If you can say it in 10 sentences, try to say it in one word or gesture. Like if you can't hear them, just gesture, or louder instead of, I can't hear you. Can you say it again? That's a lot of cognitive overload, especially as the disease progresses. We want to really keep it short and concise. And especially as they're maybe having some memory issues, live in their world. It benefits no one if you say, oh, I told you already, we're having dinner at 5 with so-and-so. That just makes everyone a little anxious, and you're pointing out maybe a deficit that they have no control over. It's so easy for us to say, be patient, but if it's your parent, it's very scary, right? It's very scary to see that person not remember XYZ. So, I feel for the caregiver or the friend or the family who's witnessing maybe that memory decline, or all of a sudden they can't drink a sip of water like they did before. So that frustration obviously comes from fear or that anxiety, but it's really important just to live in that person's world and not bring up those deficits.
Those are really great tips.
Yeah, thanks.
And really good reminders. I know that being able to listen when someone has speech difficulties, whether it is a different language or different mental capacities to speak. Years ago, I was in college, and there was a person in this class that had speech difficulties. I don't remember what disease this person lived with. And before the person spoke, I remember very distinctly this teacher who had had this student in her class before. She said, all right, everyone, I want you to take a deep breath in and take a deep breath out. And let's say her name was Jane. Jane is going to speak, and you can understand her. You just need to relax. So let's again take a deep breath in and take a deep breath out. And then Jane would speak. And it was amazing that the people who weren't able to relax had more difficulty in understanding. And after a while, we all got used to it. And we were all very able to understand her in conversation, in small group, and big Q&A. But it took us being guided to just stop, relax, and listen. Just that comment alone about stepping back and being in their shoes and learning to relax. Now, my other question is, do care partners ever come to sessions with the person? And is that beneficial to be there?
Of course, it's up to the client, but I find it very beneficial because I'm with them an hour a day, but they either live with them or they know them better, right? So a lot of what I do during the session is really helpful for that care partner, the family member, the friend, to practice that outside the session, right? So I want that carryover. If I have a good advocate or a good partner and they understand the goals of the client, that always is very beneficial if the client is okay, right? Or if they have that person. Sometimes people don't, but it always it's very beneficial to have.
Now, if someone is needing or sensing that these things are happening, typically do they go to their doctor first? Can they come to you directly? What's the process? And for people who have insurance, is this something that is potentially covered by insurance?
Excellent question. So first, hopefully they've been diagnosed by a neurologist or a movement specialist, or their primary care physician is recommending to do so. Sometimes I see that client first, and although I can't diagnose a neurological disorder, usually the client is referred by a neurologist. And it's always best to see that person early on because it's easier to maintain the function that they have, whether that's their vocal quality or their swallow function or even their cognitive function. Ideally, you're seeing that patient early on, like I said, maintaining function instead of trying to regain that function of years ago. Speech therapy is covered by insurance.
Now, you said catching someone early on. So let's say someone has been diagnosed and voice and swallowing at the present moment are not the symptoms that are showing up for Parkinson's. They might have a tremor, or they might notice their handwriting has changed, or their gait is getting a little more wobbly or unstable. Would coming and asking the doctor to say, hey, I'd like to try speech therapy, be a good preventative to do, even though that may not be a symptom that's showing up?
Exactly. When we use our voice, there are coordination of muscles that we need. We need to coordinate our breath and our voice. When we swallow, we have to coordinate our breath and our swallowing muscles. It's best, obviously, to try to engage those muscles and teach different techniques and strategies and exercises that are going to maintain that person's function or improve that person's function. And the same for cognitive things, like there are strategies that you can work on now while your memory is really intact that can help you when maybe down the line you start developing some memory issues, so that becomes second nature and it's habitual. You don't have to think about it.
I know it would obviously vary from person to person, just like Parkinson's can vary from person to person. But when someone is coming to a speech therapist, Is this something that I see you every day, once a week, once every couple weeks? Like, what is this sort of normal trajectory of intervention, I guess? And what is a typical session like?
So, the beauty of therapy, at least how I practice it, is I tailor it, like you said, to the client. So if a client has specific goals, I'm facilitating that course of therapy. Luckily, there's robust research for voice therapy for people with Parkinson's. There's the Silverman voice treatment and Speak Out. Both I'm trained and certified in both, and those are different modalities that only help with the voice, but also, like I said, swallowing and cognition. Lee Silverman voice therapy is 4 times a week for 4 weeks, and it's an hour session. And Speak Out is 12 sessions over 4 weeks. Now, many people can't afford that. It's cost prohibitive, and they don't have that time. So, of course, a client can be accommodated. The research shows that the intensive therapy is what really benefits a person, but some people do really well with just twice a week, and they are really practicing at home. And home practice can be anywhere from 5 to 15 minutes. And I tell all my clients, it's not about, going home and doing your voice exercise. It's really taking every opportunity. When you open your mouth is an opportunity to practice those strategies, practice those skills, really practicing using your voice or that hard swallow or whatever it is that the client really wants to target, what their goal is. So I had a person with Parkinson's who was a real estate agent, and he really wanted to have a strong phone voice so he could speak with authority when he was trying to buy or sell a home. I had a singer who really wanted to work on her singing voice. So we really incorporated singing into the sessions. And then I had a grandmother who just wanted to have enough stamina to read a bedtime story. So we really worked on strategies so she could read that bedtime story to her grandkid. So really, while we might be working on helping the person use their voice more efficiently and effectively, there's so many other gains that they get besides the vocal quality, the improved breath support, improved stamina, that facial animation, and really coordinating all those muscles that someone needs in order to be able to be heard and understood.
I laughed when you said, to practice it every time you open your mouth. And I thought, oh my gosh, I open my mouth a lot, but first at talking as well as, I'm eating, like we open our mouths a lot. We're standing in awe of something that we've just seen. I was like, oh my gosh, there's a lot of ways to practice. That's, it made me laugh on one level, but then I thought, wow, that's a really practical thing because we're doing it so much.
Exactly.
Whereas,
And I think it also changes that. Instead of like, this is my homework, I have to do these exercises, you understand that the function of those exercises is really to help you communicate. So, like I said, I know it sounds cheesy, but every time you open your mouth is an opportunity to practice. And you're right, you do open your mouth a lot during the day. It is a cognitive load, right? You speak without thinking about how you use your voice or where it's placed or how you're breathing. So it's a lot to sometimes think about, but the more you do it and the more you, every time you open your mouth, think about it, the easier it gets, the more habituated it gets.
now you mentioned that you have studied 2 additional trainings. I'm assuming that's above and beyond what your education was to become a speech therapist. if someone is looking for a therapist, and whether they can come and see you, or they live out of town, or they have someone they can see in through their insurance or their medical practice, how do we find a good one? Like, how do we know we've got a good one?
Yeah, so hopefully word of mouth, or your neurologist or your movement specialist or your primary care physician has a list of people that they refer to. You definitely want to go to a voice or swallow therapist, a speech language pathologist who specializes in voice and swallowing, if those are your concern, or someone who is a more cognitive therapist. I'm interested in all three because I love working with this population. So you want to look for someone who is trained not only in these modalities, but that's Lee Silverman voice therapy and speak out, but that also has an understanding of how the larynx functions, how the pharynx functions, a swallow specialist or a voice specialist.
That's amazing. What else would you want people living with Parkinson's to know? Like, what would you like to share with them? How have you helped them?
So the most important thing is to be patient with yourself. And know that you're not alone. Obviously, the JCC, your program, has amazing resources. I'm in awe of all that you offer. It's fantastic. And know that if there are things that are difficult for you to do, whether that's your voice or swallowing or your memory or the speech intelligibility, those are all things that can be addressed with a speech language pathologist. Also, use it or lose it. Unfortunately, there's a tendency for people with Parkinson's, if they are having difficulty being heard or understood, or they're coughing or throat clearing every time they go out to eat, they might not engage with their community or participate as much. And in order to maintain function, you have to use it or lose it. Your voice is produced by 30 plus muscles, and your swallowing happens because of 30 plus muscles. Some of them are the same, and your breathing requires muscles. So all those muscles are really important to use, or else we lose them, right? Muscles atrophy. If I would wave hello to you, you'd see this jiggle jaggle. That's a muscle, and your vocal cords are muscles, and you need muscles to swallow. So it's really important to use your voice, swallow often, speak, engage, and participate. And if anyone has any questions, a family member or a person with Parkinson's, if you want to call or email me, I'm happy to do a free phone consultation just to answer any of your questions or refer you to someone who can answer your questions. What you put into therapy, you get out. So even if someone can only attend a few times a week and not do the full course of 4 sessions a week for 4 weeks with LSVT, or the Speak Out, which is 12 sessions over 4 weeks. If you're practicing at home, if you're really using the exercises and techniques, you're going to get some benefits.
What have your clients who have Parkinson's, what have they taught you?
Perseverance. I'm always in awe of someone who might have reduced range of motion, or they're in pain, or their muscles are rigid. And like I said, your vocal cords are muscles. So they arrive prepared, they're motivated, and they have so much perseverance. So I'm in awe of their ability to really work hard. You know, sometimes I don't want to get out of bed and do my morning stretches, but they are overcoming so many things that we can't possibly understand because we're not living in their body or sensing what they're going through.
Wow. Thank you so much. I have learned a ton. Especially, I had no real idea what a speech pathologist does, even though I've heard the phrase, oh, probably since college. So thank you for explaining what you do and the importance of it. And I really appreciated learning that it's something to recommend or suggest proactively as people are building up their toolboxes. I know when people have approached me wanting guidance about our programs and offerings, that a diagnosis of Parkinson's can be very overwhelming at the beginning. And depending upon what series, I'm going to call it series of triggers, makes them discover the disease, right? Meaning something's been going on. It might have been going on for a while, and every person is different, but eventually they get to the place where they get a diagnosis. And while the diagnosis is helpful, because then you know what this is, it also opens up a different can of worms. And I've recently met several people who are recently diagnosed, and there's this bit of overwhelm of where do I go? What do I need to do? I have to keep moving. How do I, and reminding them that it's okay, that you take it one step at a time, small steps. And I'm encouraged to know that this is something to proactively say, once you get your routines and you figure out what the medications are and what you need for living a great daily life, because all of us are going to have something that shows up as we age. That's just living in our bodies, and we want people to live them fully. And I'm much more interested as I'm aging is how can I be proactive? Because I know that certain things run in my family, or I know that when I age, these things might happen. So what are the things that I can do proactively? And I love the idea of learning skills. And every time I open my mouth, it's a chance to practice.
Right.
Versus,
And you want,
when you're doing your weightlifting, you can't just lift the weight. I mean, yes, you can take your soda can, before you open it up, or you can do this, but you can't practice your yoga pose every time you open your mouth, right? So that's a really helpful way to think about this process.
yeah. And thank you for the opportunity. I think, like you said, it's overwhelming when the neurologist says you have Parkinson's disease or I suspect it, and here's some Cinnamate. And you might be dealing with bigger issues, right? Maybe you're recommended or referred to physical therapy first because that's your main concern, or you're having sleep disturbance, or what you thought was a GI issue is really part of Parkinson's. So you're seeing those specialists. And sometimes that voice or communication or swallow issue is the last thing to be addressed. But like you said, the earlier you can start working on those strategies and exercises, the more you can maintain the function you have now, as opposed to trying to catch up and regaining things of years ago. So there's definitely exercises out there. There's resources, the fantastic resources you have to live a great life.
Thank you so much for being here today. I so appreciated it.
Thank you so much. Thanks for the opportunity and your fantastic questions and your time.
My pleasure. I hope you found Orit as helpful as I did. And I really love the idea, if you didn't catch on, that we can practice this every time we open our mouth. How easy is that? We've included information in the chat on how you can contact Orit. Her website is www.yourvoiceandspeech.com, as well as a link to LSVT so you can learn about that technique, which was specifically designed to help people with Parkinson's. And if you'd like to sign up for the Living with Parkinson's programs here at the Marlene Meyerson JCC Manhattan, please see the link in the comments below to fill out our intake form. That will help you get started and help us find the best way to help you. Our next episode is going to be on Monday, June 13th, of Getting Personal with Parkinson's here on Facebook, and I hope you will stay tuned and join us. Thank you so much. Have a wonderful day. And I can finally say happy spring. Take care, everyone.